Queensland trial allowing pharmacists to give out flu jabs has been slammed by Australia's peak medical body. The Australian Medical Association says vaccinations should be left to doctors and nurses, and the trial is putting lives at risk.
4 years of university, one more of training. But according to the Australian Medical Association, pharmacists aren't fit to give the flu jab.
There are none who are competently trained to do this work because they're not trained to do this work.
It wants the Queensland Government to scrap a proposed trial this flu season, allowing pharmacists to administer influenza vaccinations to boost immunisation rates.
We want to improve Queensland's high rate of vaccinations, which is already running at around about 92%. We would like to get that to 95% above.
The pilot program aims to make vaccinations more accessible and cheaper because patients won't need to see a doctor or nurse.
If you increase the herd immunity from vaccination, you can reduce the risk of having pandemics.
The AMA's major concern is if a patient goes into anaphylactic shock, pharmacists don't have the skills to save their life.
We're talking about a very rare but serious and life-threatening condition, and we don't want to see just one case mismanaged.
Administering adrenaline, calling an ambulance, administering CPR, they're all things that pharmacists would be able to do.
Similar programs are already in place in the US, Canada, New Zealand and the UK, where almost 1 million flu vaccinations have been administered by pharmacists without any deaths.
The government's not put off though, and says it will also consider trialling other vaccines in pharmacies in the future. Sophie Walsh, 9 News.